Hello ma'am, good morning. I'm Jessamine Serrano, your nurse for today. And today I will be performing urine specimen collection. So first, we should do the assessment. So number one is identify the patient using at least 2 identifiers. So what is your name and birthday, ma'am?
My name is Jessamine Serrano and my birthday is January 21, 2006.
Okay, ma'am. Then second is assess patients or families' understanding of purpose and method of collection. Then next is assess patients' ability to assist with urine specimen collection. So, ma'am, can you do the specimen collection on your own?
Yes.
So next, number 4 is assess patient for signs of UTI. So do you have any signs of UTI, ma'am?
None.
Okay, ma'am. Then last is refer to agency procedures for collection method. So next is planning. Number 1 is identify the expected outcomes. Then next is implementation. Number 1 is perform hand hygiene. Then next is check the labels and complete laboratory requisition for containers. Number 2 is provide privacy, allow mobile patient to collect specimen in battery. So let's assume that I already provide privacy. Number 3 is collection clean voided urine specimen. So number 1 is apply clean gloves, then give patient supplies to clean the room. So apply clean gloves. The next is give patient supplies to clean perineum. So, ma'am, I will give it to you, then you clean your perineum. Then next is remove and dispose clean gloves. Dispose it to the proper receptacle. Then next is open package of commercial specimen kit using aseptic technique. Then let us assume that I already opened the package. Then next is pour aseptic solution over cotton balls if necessary. The next is open specimen container, maintain sterility of inside of container, then place cap properly. So this is the container. Open the container, then place cap properly. The next is assist or allow patient to clean perineum and collect. So the patient is already clean her perineum, and let's just collect the perineum or specimen. Then inform patient antiseptic would feel cold. So for male patient, sir, can you stand up? So, instruct the patient to hold penis with one hand, then clean the meatus properly and have patient retract foreskin if necessary. Then return foreskin when done. So, sir, hold your penis with your one hand. Then next is clean your meatus. Then retract your foreskin if necessary to clean it. Next is rinse area and dry if agency procedure indicates. So, rinse the area, sir. Rinse the area. Just dry it. The next is help patient pass container through urine stream after patient indicate stream. So, hindi ako naritay kayang gusto. Tay-tayaang disbong ka. Kaya ano ba kayo damo? Next is female patient. Ma'am, can you stand up, please? Siyempre, hindi ako narito sa Then spread Maria Minora with finger of non-dominant hand of patient or have patient assist. So, spread the labia minora, ma'am. Spread your labia minora. Then, clean the urethral area appropriately. Use fresh swab for each fold. So, this is the next is rinse area and dry it with cotton ball if agency procedure indicates. So let's assume that the area is already rinsed. Then let's dry it with the cotton ball. Dry the area, ma'am. Cotton ball. Then next is pass specimen container in urine stream after patient initiate stream. So, ma'am, you already has a small? Yes. Then next is remove specimen container before flow stop and before releasing labia or penis. Then assist with personal hygiene as appropriate. So, remove. Then personal hygiene. Then next is replace cap on container, touch only the outside. Then next is clean urine from exterior surface of container. And dispose the used supplies on the proper receptacle. Then perform hand hygiene. Then assist the patient on her bed. So next is collect urine from indwelling urinary catheter. So letter A is explain the use of needleless syringe and that patient would not experiencing discomfort. So the use of needleless syringe is to eliminate needle stick injury, then reduce needle reuse and cross-contamination. That is the use of the needleless syringe. So next is explain that the catheter is need to clamp from from 10 to 15 minutes before obtaining a specimen and that it would not be obtained from lineage bulk. So, I will be clamp your catheter, ma'am, for 10 to 15 minutes. So, on count. Then next is apply clean gloves, then clamp drainage tubing below with the raw side. Then clamp the drainage tubing below the withdrawal site. So, dito yung site, ika-clamp ko natin. Then next is position the patient properly, then locate the port, then clean port with disinfectant and allow it to dry. So, position the patient. Can you move, ma'am? Then locate the port, then clean the port with disinfectant and allow it to dry. So, I will use cotton ball with alcohol to clean the port. Dispose it to the proper receptacle. The next is attach the needle-less Luther loop syringe to the port appropriately. So, attach. The next is withdraw appropriate amount for culture for urinalysis. Then, transfer urine from syringe to appropriate container. So, I will transfer the urine to the container. Open the container, then the urine up, then transfer. Then next is dispose it to the proper receptacle. Then place the lid tightly on the container. So place the lid tightly. Place the lid tightly. Then wipe the container. Dispose it to the proper receptacle. Then next is unclamp the catheter, ensure the urine was flowing freely. So unclamp. Then next is secure label to container, then complete label properly. Make sure that you label the container on the container, not on the lid. Then next is dispose the soiled supplies, then remove and discard gloves, then perform hand hygiene. So dispose and remove the soiled gloves. Then, perform hand hygiene. Then next, after that, send this specimen and equation to laboratory within 20 minutes or refrigerate specimen if necessary. Then next is evaluation. Number 1 is inspect the clean voided specimen for contamination. Number 2 is evaluate patient urine CNS report for bacterial growth. Then number 3 is observe urinary drainage system to ensure it was intact and patent. Then number 4 is ask patient to explain step on the procedure. Then number 5 is identified unexpected outcomes. Then next is record and reporting. Number 1 is record the collection of specimen in appropriate log and document evaluation of patient learning. Then number 3 is report any abnormal findings to healthcare providers. So that's all for today. Thank you for watching.